After going through so much in just a span of 9 months, a woman goes through the tedious journey of breastfeeding with a smile on her face. What is taken to be the most magical moment between a child and a mother comes with its own challenges. Hi, I am Ravija Deshpande from the product management team here at Mayor Vitabiotics. Mayor Vitabiotics, a part of Vitabiotics Group company, which is UK's number one and world's fastest growing nutraceutical company, having successfully accomplished 50 years. Vitabiotics is also the 4 times winner of prestigious Queen's Award, which is the first and only British nutraceutical company to receive Queen's Award for the innovation in vitamin research. 1st August to 7th August is celebrated as the Breastfeeding Week, and on this occasion, let us make the lives of breastfeeding mothers a little easier by discussing some common questions that she might want to ask a professional. By the initiative taken by Mayor Vitabiotics, we have with us Professor Dr. Suchitra Pandit. She is a gynecologist at Surya Group of Hospitals, Mumbai. She was also the chairperson, AICC, RCOG, president, ISOPARB, was also the president, Gestosis India Association, and president, FOXI ICOG. Welcome, madam. Thank you for joining us in the initiative of spreading awareness on the occasion of Breastfeeding Awareness Week. To begin with, ma'am, we would like to know how important is breastfeeding for both the mother and the child, and what are its benefits?
First of all, I'd like to, congratulate you for taking up this initiative, because it is indeed the Breastfeeding Week. And let me start off by saying that, well, breast milk is the ideal food for infants. It is not only safe, clean, but it is also very rich in antibodies and all the immunoglobulins which protect against many of the childhood diseases. It also provides the energy and the nutrients that the infant needs in the first months of life. And not only from the baby's point of view, but even from the mother's point of view, it reduces the incidence of breast and ovarian cancer, the metabolic problems like type 2 diabetes, high blood pressure, and overall, if the mother continues to breastfeed, it is also associated with the postpartum weight loss. It is also said that, if the mother does an exclusive breastfeeding and the duration of breastfeeding is more, then it is associated with a greater weight loss. So this is like a win-win situation for the baby as well as for the mother. Hence, breast milk is an ideal, food for the child as well as, the mother who is breastfeeding. There are benefits for her also.
So, as rightly said, it has benefits for both mother and the child. So, we should know that breastfeeding is the ideal source of supplement for the child.
Absolutely.
Ma'am, for the breastfeeding mothers, what are some essential nutrients that a mother must consume to fulfill her body needs? And then what are certain food or beverages that she must avoid totally?
Right. See, we always tell the pregnant mother, there's a diet where she has to have a, balanced diet where she has to increase the amount of proteins, vitamins, minerals, as well as fats. The same is true about lactation, because she must have an adequate energy intake, a balanced diet, which contains fruits, vegetables. And if she's a vegetarian, obviously she can have the various lentils, the sprouts, which are the sources of protein, paneer, soya. And if she does consume non-veg food, she can have the animal proteins like chicken, fish, any kind of meat and eggs. But what is very important is, along with this, there should also be the food which is rich in iron and calcium. So intake of milk is very, very important. Milk, and she doesn't like milk, then obviously buttermilk or yogurt or, the standard curds is also very good. And for iron, the green vegetables. Then locally, you have there's a thing called ragi or millets. These are again very rich sources of iron and calcium. And of course, then she must also have iodine and vitamins. Now, sometimes these things are not there, in adequate proportions. So therefore, we prescribe some supplements, and we also need to give DHA because that is important for to be secreted in the breast milk. So therefore, once a woman has delivered, we give her iron and calcium in pregnancy. We tell her to continue the iron and folic acid in the postpartum period, more so because the breast milk can transmit the iron and the folic acid to the baby, but also the mother's reserves get built up. So minimum of 3 months post delivery, she must take the iron, folic acid, and the calcium should be continued right into the postpartum period up to 1 year till she is breastfeeding the baby. And vitamin D supplements are also very important. Now, sometimes what happens is the mothers, they may have certain diet problems, certain facilities, they have to adjust accordingly. They can probably consult their obstetrician or pediatrician, and then they would guide them. But what we would always say that have healthy food, avoid eating food which is not cooked in a hygienic way, avoid alcohol in any form, very highly processed foods or food, like caffeine. Many women like the strong coffee or the strong tea. The mild tea or the mild coffees, which has got plenty of milk in it, is fine. But something which is very strong in caffeine and tannin content is not recommended, because this gets secreted to breast milk, and the baby probably may then not sleep very well. And also, some women are allergic to certain things. Sometimes, peanuts or certain different types of nuts or even eggs. I mean, whatever they're allergic to, they should avoid. And along with all this, the woman must eat small, frequent meals because she's feeding the baby regularly. So she can get, tired. She needs all those nutrients and plenty of fluids. Very, very important.
Okay, ma'am. So, the caffeine, as you rightly said, many mothers have this confusion that they want to consume coffee or tea. So, thank you for putting that out. I think this is surely going to help the mothers to
Yeah.
choose
The
their
South
nutrients.
Indian coffee which they make, the filter coffee, which is perfectly fine. It's got
Yes.
lots of milk. The coffee which we make at home, it's got lots of milk. The coffee which you get, women have that black coffee. So most of the times when they ask in pregnancy, I tell them to avoid the strong black coffee and the strong teas. But if it is with milk, the way it is made at home, then that's okay. Again, in a moderate proportion.
Okay. So, ma'am, during pregnancy and breastfeeding, even a simple headache can cause a confusion for the mother, whether she
Absolutely.
can consume that medication or not. So, ma'am, are there any medications that needs to be avoided at all costs during the lactation period altogether?
Yes, there are certain groups of medication which definitely need to be avoided. In those situations where the mother has to be given anti-cancer drugs or drugs, like anticonvulsants, certain groups of anticonvulsants or radiopharmaceuticals, then these definitely, the mother who's taking these, she needs to avoid breastfeeding. Again, there are mothers. Fortunately, in India, we don't have so many of that, those mothers. But if they are on drug addiction, like opium, heroin, cannabis, marijuana, any of those, if they are not able to get de-addicted, again, chronic smokers, I think these mothers should avoid breastfeeding till they have, taken some help from the doctors to try to get de-addicted. But remember that anything that the mother needs, if she is in doubt, particularly if she say she has a headache and she wants to take a paracetamol, that's fine. But then repeatedly taking medication without consulting the doctor is not advisable. So the golden rule is, if you have to take any antibiotic or any medicine, please check with your doctor. Is this okay to take? Because most of the medicines would get secreted in breast milk. The proportions may be small, but if you double check with your doctor, it's always advisable.
Okay, so the silver line is that the mother should always ask and consult a doctor before she consumes any medication on a whole.
Absolutely.
So, ma'am, for the viewers, can you explain what exactly is colostrum? And is it okay to have only a few amount or a small amount of the colostrum for the mother? Because this is a common concern for the mother. So, can you elaborate a bit on it?
Absolutely. This is a very important question because most of the women, in the first few days post delivery, will say, Doctor, I'm not actually lactating. I'm just getting this sticky white, discharge. But this is what is colostrum, the first milk. And this is the first form of milk which is produced by the mammary glands soon after the delivery. Now, remember that colostrum is very rich in nutrients, very high in antibodies, that is immunoglobulins and antioxidants, and these help the baby to build up its immune system. And usually, for the colostrum to change into milk may take 2 to 4 days, and once the baby is born, and it's normal to have a small amount. So, the baby should take this. In fact, the mothers should encourage to at least have a few teaspoonfuls of the colostrum to fill their tiny stomach. And also, what is important is gradually when they feed the baby with this amount, the baby is satisfied, and the initiation of the lactation starts right away. The change from the colostrum to breast milk will gradually occur. So the mother shouldn't panic and shouldn't think, oh my God, I'm not getting proper breast milk. So what should I do? So colostrum is very, very important.
So now I'm sure the mother will know that the change will happen slowly and gradually between the colostrum and the actually lactation milk. So new mothers have these concerns, ma'am, that will they have enough milk for their child, and how long should she feed the child, and for feed, what should be the duration? So what should be the ideal duration of it?
Right. See, most of the mothers, particularly the first timers, the primies, as we say, primary paras, they're always concerned whether feeding the baby is it adequate or not. But it's important to note that the baby suckles and the baby takes as much as it wants. So we, the doctors, the obstetricians, as well as the pediatricians recommend exclusive breast milk for the first 6 months. There's no need to add water, particularly where, it's summertime, women tend to feed. Should I give a little water? No, it's exclusive breast milk for the first 6 months. Now, after 6 months, the pediatricians do advise some kind of a, either a supplementary food, or they try to introduce the solid or the semi-solid foods. But that do it as they advise, as the pediatricians advise. But try to feed the baby even beyond 6 months, say up to 2 years. If there are working mothers, they do get the maternity leave for 6 months, but they can always store the milk and keep. They can always many of the the corporate offices and some of the government offices have provided a creche where the babies can be kept. The mothers can keep coming in between and feed their babies. And each breastfeeding session may last, it depends on how strongly the baby is suckling, maybe 20-50 minutes on each side, sometimes 15 to 20 minutes. Some babies learn fast and they suck very fast, so the amount of milk produced, the flow is very good. Sometimes they may take a little time, and the mothers may need to be a little more patient and need to cajole the baby and focus exclusively on breast milk breastfeeding till the baby and the mother are used to each other.
So a mother will eventually get cues from the baby, and she will learn what is the ideal duration for her child. Is that
Yes,
correct?
absolutely.
Okay. So, ma'am, in the Indian households especially, the relatives, neighbors, aunts, uncles all have this pressure on the mother that if she is being able to fulfill the needs of a child, if she can give enough for the child to eat. So, how can a woman tell that if she is giving enough to eat?
Yes. See, the pressure will be typically from the mother or the mother-in-law or whoever is looking after her. to eat more because she must produce more. But what is very, very important is every baby knows how much it wants. So the mother should take cues from that. Particularly, the babies may feed 1 to 3 hours in the first 2 months. Most of the times, we recommend that, give the, wake up the baby. The babies are sleeping most of the time, but try to nudge them and try to get them, put them to the breast every 2 to 2.5 hours. But usually, once the baby and the mother have adjusted to each other, the mother will know, she'll pick up and she'll find out when the baby is wanting the feed. And this may be every 2 to 3 hours. And as long as the baby is putting on weight, the baby is not cranky, and the baby is passing, urine and stools. Mind you, newborn babies may not pass stools every day. It may be one every alternate day. So the pattern changes. It usually takes some time to establish a routine. So what is most important for the mother to know is keep patient. And if she's worried, obviously she can consult her pediatrician. And another important thing is after every feed, the baby should be burped. So the baby burps are not very loud. They're very, very soft. So it's important for the mother or whoever else is helping the mother with the baby to know that the baby is burped, because then there is no regurgitation of milk. And usually now within sometimes I would say 6 weeks to 2 months, the mother and the baby establish a routine between themselves, and then the mothers are not bothered anymore.
So it's again a formation of a routine that the mother will slowly get used to it, and even the baby will. So, ma'am, now we are heading forward in the society, and as you rightly said, women are rejoining the work and with the support of their loved ones. So, ma'am, how can mothers continue to feed their infants even after returning to work? Because that is the major challenge.
Absolutely. So, today we are recommending that if they can extend their leave, the baby is thriving on breast milk, and they can always extend it if they have enough leave. But if they're unable to do that, before they go to work, they obviously feed the baby and they can store the breast milk and keep. There are various ways of doing it, which I can tell you just a little later. But even in some of the offices, as I told you, they have kept creches where the babies can be kept there. They're looked after. And whenever the mother, she's at work, she can always come down there to the creche, feed the baby, and then go back to work. And of course, there are very good quality breast pumps now available where the mother can actually, pump milk and keep it at home. And she can instruct to the, whichever relative is there, the mothers or the mother-in-law or the sister, or some of them have got some, nannies. So they can actually feed the baby with a vati spoon or with a palada. Some places they also recommend using the bottle. My only concern with the bottle is they should be thoroughly sterilized if they're going to use them for, putting in the stored breast milk in that. So if we teach the babies to, have with the vati spoon, nicely stainless steel vati and spoon, or with the palada, it is not difficult. It is easy to do that. And should I tell you how they're doing it, how they can store the milk?
Yes, ma'am. That was going to be my next
Basically, it's a simple rule which they follow. If it's at room temperature, the milk can be kept for 4 hours. If it's in the fridge, it can be kept for 4 days. But if you're keeping it in the freezer, it can be kept for 6 months. Sometimes they say even 1 year, but I would say 6 months is, safe. But wherever they are keeping it, the fridge, they should ensure that there is a continuous supply of electricity, because there are some places where the electrical connections go off, then they have to be very careful in those places. Second thing is, whenever they are pumping the milk, the breast pumps, they have to know how to use it. They could be manually operated, they could be electrical pumps, and the electrical pumps sometimes are a little more easier. The manual, it's a physical effort to be done by the mother or the lady who's helping the mother to store the breast milk, but it should be collected with clean washed hands collected in stainless steel. There are small containers which are available. Some companies provide the ready-made containers, but they should be properly sterilized before the milk is kept in there, and they should be the lid also should be properly covered. Mind you, if the milk is frozen, that milk has to be used. It should not be kept in the microwave to thaw it, and neither should it be boiled. Leave it at room temperature, it will automatically thaw. Same the concept that if the milk is kept in the fridge and it is cold, do we need to warm it? No, you don't need to warm it. You can warm it either at room temperature or by secondary heating. Now, how is the secondary heating done? A utensil which has warm water, not boiling, warm water. This particular tin can be moved in that container so that by the secondary heating, the milk gets warm. So never heat it up on a stove or a gas or even in the microwave. And this can again be fed, as I said, with a vati spoon, with a palada. And only whoever is doing this job must remember not to put too much into the baby's mouth because they're small. And after every feed, the burping is very, very important.
So these are the common concepts that the mother has and she concerns. And I'm sure that all of your answers is surely going to help all the working women, especially because now their concerns would be a little less. She would know what she's doing and what she's supposed to do.
Absolutely. And Ravisha, can I also add that many of the hospitals, like at Surya, definitely, but many of the public hospitals also have got the human milk bank. This concept was started many years ago by Dr. Abida Fernandez. And the whole idea was if the mothers can donate, healthy mothers, they have a list of all the, prerequisites. If the healthy mothers, if they got extra milk, they can donate this. And this milk is actually utilized for small preterm babies where the mothers are not producing milk, or mothers who are very ill, or for some reason the mothers are not getting adequate amount of milk. So this is a very rich bank where the milk is stored, it is pasteurized and kept as per the protocols, and this milk is available. And many of the places they will not charge for this milk. So they're not able to supply healthy infants, but at least the babies who are sick, they are able to get this source. So this is this is important government initiative now. They're directing most of the maternities which have got more than 500 deliveries per month, where there are babies born, there are newborns born, where they have got NICUs where they look after the smaller babies. They've advised to have these human breast milk banks.
Thank you for sharing this information, Doctor. I'm sure that most of the viewers who are watching us right now, they must not be knowing that a facility with breast milk of healthy mothers is available for children and mothers in need. So thank you for that. So, ma'am, latching of the baby to the breast is a very important aspect for breastfeeding with ease, and we all know this. But for our viewers, doctor, can you explain what exactly is latching and how important is it, and what a mother must do if the baby is actually having trouble to latch to the breast?
Correct. I think this is the first and most important step, because latching is the way the baby gets onto the breast and takes the nipple and the areola into the mouth to suckle. Now, what happens is babies initially will always take only the nipple, and they may not take the areola all the times. So gradually, the mother also gently, helps the baby to get on to latching. So it's important that the entire areola is the black portion, just around the nipple. So the baby takes the areola. Then when the baby presses the areola into the mouth, then the nipple spurts out the milk. And that is very important. So many times what we advise is, if the baby is ready for feeding, the mother should squeeze the breast and get a little milk coming onto the nipple So the baby knows that there is milk coming from the nipple. So the baby then gradually gets, attracted. It's a tactile sensation, and they get attracted to it, and they, latch on. Latching on may take a little while. The positioning also, different kinds of position help to, get the baby latched on better. But there are times when the mothers have got, retracted nipples, that is, nipples going inside. So in the antenatal period itself, in the ninth month, generally after 34 weeks or so, I do advise mothers to pull out the nipples so that they are able to take these nipples, that they're able to pull them out nicely. So in the postnatal period, if they haven't done it, we help the mothers. We help the mothers to do that, and we help the mothers to encourage the baby to, then take the nipple. But if the retracted nipples haven't come out, sometimes devices like nipple shields also help. So by the negative, the nipple shields have to be applied onto the areola, and by the negative pressure, the milk comes inside and the baby gets the milk. And sometimes, even in the hospitals, we have simple things like we have, syringes. So maybe like a little broad syringe, we cut off the top portion of it, we apply it onto the areola, and then we pull the nipple upwards. So these are simple devices which can be used. But today, with the availability of the nipple shield, this does help. But mind you, as soon as you feel the nipples have, come out, have protruded properly, once the baby stop breastfeeding, continue that exercise. Otherwise, what happens is the baby can, have the problems of latching on. And once the nipples have protruded, then the mother should not worry about the breastfeeding.
So latching is absolutely important for
Yes.
both the mother and the child. And if the mother is actually facing difficulties, then she can consult a doctor who will
Yes.
help her out and find solutions for her problems.
Absolutely.
So, as we already discussed, for a mother, a new mother, there are instructions given by grandparents, relatives, even neighbors who don't even know her. And they might tell her that, your baby is sleeping, so you should not wake the baby up for their development. So this is a very usual concern for the mother, that should she wake up the baby, newborn baby especially, to feed him or her.
Yeah. See, usually we advise the newborns, feed them every 2.5 to 3 hours. If they're sleeping, gently nudge them. If they're tightly wrapped up, with the warmth, they tend to sleep more. So open up the baby. Maybe just tickle the baby a little, or on the sole, and take the baby closer to you, so the baby starts smelling, the milk. Open up the breast, squeeze a little bit of milk onto the nipple, get the baby's face closer, and the baby then starts knowing that, yes, I have to, it's time for me to feed. Sometimes, over a period of time, the babies then take about 4 hours. But, in the initial phases, we definitely say about 2.5 to 3 hours, wake the babies up. Once
So
the
she should.
turns, the baby then starts crying, or, they give cues. Actually, crying is one of the last cues that the baby gives. They have lips smacking. Sometimes, they keep moving their heads. They'll keep moving their he's now ready for a feed.
So it is between the mother and the child, and she will obviously
Absolutely.
form a connection. She will know when the child
Absolutely.
needs it.
Yeah. And that support which they get from the home, the mother, the grandmother, sometimes
Yes.
the children also helps, or, an elder sister who's already had a baby. So these people do try to help. So sometimes, the mother gets very disappointed, a new mother, and she says, oh my God, the baby's not getting up, the baby's not feeding enough. So it's for the relatives and whoever is caring for the mother to support her morally, mentally, physically.
So support is very important for a new
Absolutely.
mother from everyone who is around her. So she will benefit from it surely.
Absolutely.
Ma'am, pregnancy itself is a huge challenge. And we say that a woman is reborn when she gives birth. And she goes so much, as you rightly said, mentally and physically. And many mothers are worried that even the breastfeeding journey is going to be painful. So, can you discuss a little bit more on this?
Yes. Today we have antenatal classes, and sometimes mother also attend the online sessions, apart from the physical sessions. Even in our own clinics, we talk to mothers to be, particularly in the last trimester, we start discussing, their views on breastfeeding, encouraging that you should, get the breast ready and that you should breastfeed your baby. Sometimes they have concerns and they ask these concerns, so it's for us as doctors to allay their fears and their anxieties. But remember, very importantly, in the postpartum period, the earlier we initiate breastfeeding, the better it is. And that is what we call as a golden hour. Within the first hour of the baby's birth, the baby should be put on the breast. If it's a normal delivery, post delivery, the baby can be put onto the breast immediately for the breast crawl. But in a case of a cesarean section, till the procedure is over, we wait. But then within the first hour, the baby should be put to the breast. In preterm babies, the situation is completely different. Or in babies who have got the mothers have a medical problems and the babies have to be delivered earlier, or the babies have some problem. Those are different situations. But all in all, whenever the mother has decided, most of the mothers will decide to breastfeed. Breastfeed shouldn't hurt. The mother should, initial phases, there may be, there may be nipple cracks and sores and position challenges. But once all that is over, the mother should enjoy the breastfeeding, and we as doctors and the supporters at home should help. So sometimes, we tell them, we discuss about the diets, we tell them about certain nutrients which help in increasing, in the Indian homes, there's this tradition to give the, the Gondka laddus, where these are
Yes.
rich in lot of dry fruits and they have a little ghee in them and they have galactogogues in that. So, they can consume these laddus because they do help. Certain foods which I've already mentioned before, all the fruits, all these can be had to improve the, the lactation. But every mother may have a little discomfort initially, but if there is pain, then she should immediately report to the doctor, because then, we can give them advices, because sometimes there are cracks which are very painful, or there is blood coming from the cracks, or sometimes, there's tenderness in the breast, pain, there is fever. In those cases, the mother should immediately contact the doctors, because sometimes if the latching has not been proper, or if the baby has taken only the, the nipple, there can be cuts and the baby is dissatisfied because the baby is not able to draw the milk properly. And sometimes there is mastitis where there is inflammation of the breast. But remember, mastitis is different from a breast abscess. Breast abscess is a little more serious. The mother has fever, has a lot of pain. And earlier times, we used to ask them to, come, and we used to do an incision and drainage. But today there are different, more conservative modalities where you can actually, under ultrasound guidance, or even if there is no ultrasound, the most pus pointing portion, you can actually withdraw the pus with a syringe and a needle, of course, giving local infiltration. The whole idea is, if that pus is removed and the woman is kept on antibiotics and anti-inflammatory, she can still continue to breastfeed. From the healthier side, yes, but even from this side, the milk can actually be pumped out, and the milk can be given as long as it is not blood stained.
So, a mother need not worry much that
Absolutely.
a breastfeeding journey would be specifically painful.
Absolutely.
But if the pain occurs, then there might be solutions that the doctor can give her. So she need not worry so much about the breastfeeding journey.
Yes. And Ravija, I'd also like to say that if there's a correct positioning, mothers often wonder, how should I position myself? So finally, we see whatever is comfortable for the mother and whatever is comfortable for the baby. But the standard positions are, if she's, in a semi-reclining position with the back well supported with adequate amount of pillows, she can hold the baby. First of all, the mothers are very scared of holding the babies. So the doctors, the nurses, and the lactation consultants today, we have this group of people also who are trained, so they can teach the mother how to hold the baby. So it could be a standard, a cradle position where the mother has got both the arms like this and she's holding the baby. So she's supporting and she's exposed her breast and she's feeding the baby. Or there is a double cradle position in which the baby lies on one arm and with the other side arm, the mother supports the baby's head, and then she can maneuver the breast a little, she can maneuver the head a little. Of course, she has to be well supported because breastfeeding sometimes can take, initial phases can be hours. So the mother's back should be very well supported. She shouldn't bend forward too much. So, her back should be supported and she should be sitting on a comfortable sofa or a comfortable bed. Again, there is a position which we call as a football position, which is basically football or the rugby position, where the mother actually holds the baby, as though she's holding a football, like a football technique. So she holds the baby's head. The rest of the baby's body can be supported by enough pillows which are lying by her side. This way, the baby is close to her, and the football position helps. And football, particularly in twin pregnancies, when there are twin babies, this position is also helpful. It relieves the mother of a back, and more so if mothers have undergone C-section. The baby then is not put on to the abdomen where the scar is, it doesn't hurt. So this position, the mother is very comfortable and she can change, alternate the positions, the right side, the left side. And there is also sometimes, lying down. We don't generally recommend lying down unless the mother has got a very severe backache, because in the lying down position, sometimes the breasts are much more bigger and the baby's face is small. So the babies can be overwhelmed. They can be smothering. Sometimes the mother has fallen off to sleep. They can be unpleasant incidents and we want to avoid that. There can be aspiration. The baby can have more of your problems. So the semi-reclining position is always better. Once the babies grow a little bigger, the babies even have the koala position, which is the upright positions. So the baby is supporting. This is usually a 6-month-old baby where the baby is supporting the back, the neck. So they can actually sit on the lap. They can be comforted, and the mother can, feed the baby on that side. It's the koala, like the koala sit, the koala bed, the same way the babies can be made to sit. In some of the villages, women are working also. So they strap the baby onto their bodies with a sling. And now this is adopted in some of the Western countries, in Indonesian countries, where the baby is strapped onto the mother's chest, and a mother can put on a sarong so that she feels comfortable. She can carry about a household work. The baby takes milk whenever it wants, but the mother has to be aware that the baby is feeding when the baby is slept off. Again, you don't want incidences where the baby's nose is pressed very strongly against the baby's breast. So there are different positions, but eventually, whichever position is comfortable to the mother and the baby, there are, today breastfeeding pillows. Even they are comfortable, but the mother should know how to feed the baby. And one important tip which I want to give is, whenever the mother knows the baby is ready for a feed and it's not crying, sometimes babies get very angry and they yell out. Don't wait for that time. Look at the baby cues. Once you are ready, you position yourself, drink your water, or if you have to use the restroom, before finish that, take your snack, or if you have to keep your mobile next to you, or because once you're feeding, you can't get up. And if you want your TV remote with you, of course, in the initial phases, I say just focus on the breastfeeding. Once you're, and that connection between you and the baby is established, then all these things are fine. But you mentally be prepared, and breastfeeding can be an enjoyable experience for the mother as well as the baby.
So I'm sure that all of the in-depth information that you have given, now the mother can choose the position which is the most suitable for her, which is the most comfortable for her, and she can easily breastfeed her child. So, ma'am, are there any circumstances under which a mother must avoid breastfeeding totally?
Right. Fortunately, there are very few such situations. But if the mother is very critically ill, she's on, ventilatory support for some complication of pregnancy, or she's in a situation where there is a cardiac failure, or if the mother is having some acute viral infection like the human T cell lymphotropic virus infection, which is known as the HTLV 1 and 2, or the Ebola virus infections, those are the situations where you want to avoid the breastfeeding. Again, I'd like to say that if the mother has got HIV 1 and 2 and she's on antiretroviral therapy, she can choose to breastfeed the mother, but she has to be counseled before. There are advantages of breast milk definitely for keeping the infections like necrotizing enterocolitis down and for giving the baby the natural immunity. But there is a percentage of HIV virus which can be transmitted through the breast milk. But if the mother is already counseled about this, she can, decide about the risk benefit ratio and feed the baby. But if she's going to exclusively breastfeed the baby, then it's fine. But it should not be a mix and match policy. But if the mother has opted not to feed the baby at all, she's been counseled about this before, she's already on the retroviral therapy. In those situations, she can opt not to breastfeed, but never should she be tempted to do a mix and match. And if the mother is newly diagnosed with HIV 1 and 2, and she's not yet on the antiretroviral therapy, and probably the levels are not sufficient enough to give protection, in those cases also we recommend that the mother should not breastfeed the baby. Again, there are situations, fortunately we have few of those situations where the mothers are addicted to alcohol, or where they're addicted to drugs like opium, marijuana, or heroin, or any of that LSD group. So in those situations, the mother should be offered de-addiction before they want to venture out into breastfeeding. And of course, most of the mothers who are smoking in the preconception period, if they've come to the gynecologist for a preconception counseling, we advise them against smoking. And even passive smoking is not recommended. So in the antenatal period, most of them have given up smoking. So post-delivery, we should encourage them to continue with the no smoking policy, not just for themselves, also if the partner or anyone in the house is smoking, it should be a smoke-free atmosphere for the baby. So, we must try and make sure that the mothers don't go back to the smoking policy during breastfeeding.
So we say that breastfeeding is a beautiful journey and all mothers should, do it. But now we know that under what circumstances a mother must avoid it. So thank you for that.
And Ravija, today, all over the world, what is being advised is breastfeeding anytime, anywhere, whenever required. So whether it's an airport, whether it's a hospital, whether the woman is working in a school or she's working in an office, there should be dedicated areas so the mother can get enough privacy. That place should also be clean. You can't tell the mother to go to the bathroom and feed the baby. There should be clean environment. And there are, even in the airports, you see dedicated areas for the babies to be breastfed. If their diapers have to be changed, the mother can do it comfortably in a clean and in a hygienic surrounding. So I think all of us, not just doctors, everybody should encourage all our young mothers to breastfeed exclusively for the first 6 months. They can continue to breastfeed for 1 to 2 years, and of course start off with the supplementary feeds at about 6 months, but to continue to breastfeed.
During the initial stages, especially, a mother has lack of sleep. It is a new lifestyle, a new life, and everyone is pitching in with their ideas. So, in that circumstance, she may neglect certain signs and symptoms that might need a consult from the doctor. So, ma'am, what are certain signs and symptoms that when the mother sees, she must not avoid at any cost, and she should immediately consult a doctor. You had mentioned a few earlier, so if anything other than that, if you want to mention here.
Yeah, no, I'll just like to summarize again. If the nipples are very sore and the mother is unable to give the nipple in the mouth of the baby, so there are cracks on the nipples, or sometimes there is blood coming out from the nipples. If there are cuts which look infected, there are white marks on the nipple. Probably the baby has got thrush, and the mother, while feeding the baby, the nipple also has contracted that fungal infection. Again, if the breasts are feeling very, very warm, very painful, if the moment the mother touches the breast, it is tender, or if the mother is running fever, in those situations, the mothers should consult. Sometimes, Ravija, the mothers have a very good flow, and the babies don't want that much of milk. And the mothers, they keep the milk just keeps overflowing. The mothers are worried, what do you do? Because it stains their clothes. So what I recommend is you can use breast pads. There are small little Turkish towel, clean
Yes.
small towels where they can cover so that the milk can go into them. And of course, if the mother has got additional milk in those situations, she can pump out and keep the milk for further storage anytime, because it also helps to keep that flow of milk going. And then another thing which I'd like to see is if the breasts sometimes they get very congested and they are large. Obviously, the breast size increases in pregnancy and during lactation, so they can use a Turkish towel or a roll of a towel under the breast to help the baby to feed. If the baby is crying constantly, or the baby is not happy, the baby is giving cues that there's something wrong, then the mothers again should consult, because probably the baby is not latched on well, and that's the reason that the baby is not happy.
So, ma'am, you have covered all the aspects of what a breastfeeding mother must know, what are the do's, what are the don'ts. So, thank you for your wonderful insights, doctor. And I'm sure that this is going to help the mothers and ease their nerves about breastfeeding, especially. And thank you for joining us and providing us the answers for all our questions that our viewers might have. So during the campaign that Mayor rolled out and the market research for the same, we found out that still in day-to-day lives, breastfeeding mothers are facing challenges, whether it be criticism from the family that she's not been able to provide enough milk for her child, or the lack of facilities in India still for breastfeeding. Society needs change, and I'm sure that by this discussion today that we have had, we have done a little bit on our part to bring change to the society. So thank you so much, ma'am, for being with us today and joining us in this discussion, which will surely benefit the mothers. This program was brought to you by Mayor Vitabiotics, which is a part of Vitabiotics Group Company, which is UK's #1 and world's fastest growing nutraceutical company, which has successfully accomplished 50 years. Stay tuned for more such clinically rich discussions. Take care and have a great evening ahead.